Hello again. I'm here this time in the middle of Stockport in the Choices Centre, which is our new integrated sexual health and contraception service. The service always was based here for the community, but there was then also a hospital service at Stepping Hill, which we have relocated as a fully integrated service. We provide services for adults, but also specialist services for youth under 25 years old. This is very much part of our long-term strategy to move services wherever possible away from the hospital and out into the community. So it's a real pleasure to be here. As you can see from behind me, it is very central for public transport links. The train station is not very far and the bus stop is immediately outside. It's a service that is very well respected and used by our patients in Stockport, and we see around 80 patients every day here. As I mentioned in the last podcast, we're now in a period of turnaround. As an organisation, we are spending more money than we are receiving this year. In fact, our cost reduction programme, which has already identified £7 million, but not yet delivered on them, still has a £10 million gap. It's something we're working on through a programme called Building a Sustainable Future, which is largely a transformation programme, but also involves cost reduction work. I have also appointed a turnaround director called Phil Church for a 12-month period. Now, it's not Phil's job to actually undertake the transformation and cost reduction programme, but he is here as an expert in the area to support us and our staff to actually deliver the changes that we need. It's a 3-year programme. This year is very, very important in that we're going to have to make some difficult decisions around short-term cuts in order to put ourselves in a position to make those transformations over the remainder of the year and into the next 2 years. It is not going to be easy, and it's something that I've spoken to our staff about on a number of occasions and will be something that will feature in future podcasts for the foreseeable future. We continue, unfortunately, to struggle with our A&E target. We're working on Unscheduled Care Programme Plan number 2, and to that we're going to be adding initiatives around how we can particularly improve the evening times. This is the period when we get the greatest number of breaches of our 4-hour target, when patients are therefore not receiving the very best of patient experience. We have asked a number of our executives to cover this twilight shift, and they have been doing so for a number of weeks. I myself undertook a shift on Sunday night last week and spent just over 8 hours in the department, first working on the triage area, which was fascinating to observe because there were indeed patients who perhaps could have been treated elsewhere than the accident and emergency department. My observations and those of the other executives are all being taken forward, and any actions from those will be incorporated into the unscheduled care plan. The other piece of news that we've got, and I am keeping fingers crossed on that, is that we have interviews coming up for accident and emergency consultants, and I'm very hopeful that we might make at least one appointment. So watch this space, and I hope to be reporting good news on our next podcast. And finally, as part of our transformation programme, we're doing a considerable amount of work on outpatients. This is an area where we believe we can improve the follow-up appointments, which are not necessary at the hospital and can indeed be undertaken in the community or in primary care. We have been looking particularly at 2 areas, at respiratory medicine and cardiology. And a survey to date has found that about 5% of the patients we looked at didn't even need any further medical input, whereas 30% could actually be seen in primary care. This project is very much a partnership with the Clinical Commissioning Group, and we have got a lead GP, Juida Idu, and we've got a lead consultant in the hospital, Jill Burrows, who are working together with a team of managers to make the necessary changes. Once we've completed the work around respiratory and cardiology, we'll be going on to some other specialties. Those will include things like ENT, haematology, rheumatology and gynecology, and those will be the focus of work over the coming months. It's something that should again improve patient experience so that wherever possible they're not having to come to the hospital for their follow-up care. And it makes sense to the Clinical Commissioning Group and the Trust in terms of budgetary pressures. Thank you.